Did you know that changing one's diet can help alleviate the symptoms of PCOS for many people? You've heard that right. Welcome back to Fit Junkies. In this video, we'll be exploring the most effective dietary strategies for managing PCOS symptoms and promoting overall health and well-being. We'll be discussing the best foods to eat, as well as those to avoid, and providing practical tips for implementing these dietary changes. Polycystic Ovary Syndrome, also known as PCOS. PCOS is a hormonal disorder that affects up to 10% of women of reproductive age, and it can cause a range of symptoms, including irregular periods, weight gain, and insulin resistance. Whether you have PCOS or are simply interested in learning more about healthy eating, this video is for you. So sit back, relax, and let's dive into the world of PCOS and nutrition. Can PCOS be influenced by diet? Insulin levels in people with PCOS tend to be elevated. The pancreas secretes the hormone insulin. It facilitates glucose, sugar conversion in cells, hence providing cellular energy. High blood sugar levels might be developed if not enough insulin is produced. Insulin resistance, in which the body resists the effects of the insulin it does generate, is another possible cause. To maintain normal blood sugar levels, the body of an individual with insulin resistance may secrete large amounts of insulin. Increased production of testosterone and other androgens by the ovaries has been linked to elevated insulin levels. Having a greater body mass index has also been linked to insulin resistance. People with Polycystic Ovary Syndrome or PCOS commonly struggle with insulin resistance, which can make it difficult to lose weight. Insulin resistance and subsequent weight gain may be harder to control when the diet is heavy in refined carbohydrates such as starchy and sugary meals. What happens if you have PCOS and follow a ketogenic diet? A ketogenic diet is a low-carb, high-fat diet that has been shown to improve insulin resistance, a common issue in women with PCOS. By limiting carbohydrates, the body enters a state of ketosis, where it burns fat for fuel instead of glucose. Studies have shown that a ketogenic diet can lead to weight loss, improved hormone levels, and better insulin sensitivity in women with PCOS. This can translate to more regular periods, improved fertility, and even reduce symptoms of depression and anxiety. How about a Mediterranean diet? So, what exactly is a Mediterranean diet? It's a diet that focuses on whole foods, healthy fats, and plenty of fruits and vegetables. Think of lots of leafy greens, nuts, fish, and olive oil. Yum! By incorporating this diet into your lifestyle, you can experience a myriad of benefits. For starters, it can help you lose weight, which is crucial for managing PCOS. It can also improve insulin resistance, which is often associated with PCOS. Plus, it can reduce inflammation in the body, which is a common symptom of the disorder. But that's not all. A Mediterranean diet can also improve your mood, boost your energy levels, and reduce your risk of heart disease. It's a win-win situation. So, if you're struggling with PCOS, consider giving the Mediterranean diet a try. With its delicious and nutritious foods, you'll be on your way to feeling like your best self in no time. But what about a low-age diet? Many women with PCOS turn to low-age diets as a way to manage their weight. But is this the right approach? When you follow a low-age diet, you restrict your calorie intake to a very low level. This can cause your body to go into starvation mode, which can wreak havoc on your hormones. For women with PCOS, this can further disrupt their already imbalanced hormones, leading to irregular periods, acne, and hair loss. Additionally, a low-age diet often lacks the nutrients that women with PCOS need to manage their symptoms. Women with PCOS often have a higher risk of insulin resistance, which can lead to diabetes. A low-age diet can exacerbate this problem by causing sudden spikes and drops in blood sugar levels. Instead of turning to a low-age diet, women with PCOS should focus on eating a balanced diet that is rich in whole foods. This can help to stabilize their hormones, manage their weight, and reduce the risk of developing other health problems associated with PCOS. So, let's ditch the fad diets and focus on nourishing our bodies with healthy whole foods. Lastly, what about having a vegetarian diet? Firstly, a vegetarian diet can be an excellent source of essential nutrients such as vitamins, minerals, and fiber. This can help improve insulin resistance, a common symptom of PCOS. Additionally, a vegetarian diet is typically lower in calories and fat, which can be beneficial for weight management, another important factor for PCOS. Moreover, a vegetarian diet is also associated with a lower risk of developing certain health conditions, such as heart disease and type 2 diabetes, which are often comorbidities of PCOS. However, it's important to note that not all vegetarian diets are created equal. A well-planned vegetarian diet that includes a variety of whole foods such as fruits, vegetables, whole grains, and legumes can be incredibly beneficial for PCOS. But a vegetarian diet that relies heavily on processed foods and refined carbohydrates may not be as helpful. All in all, a vegetarian diet can be a healthy and effective dietary intervention for PCOS. But as with any dietary change, it's important to consult with a healthcare professional to ensure that you're meeting your individual nutritional needs. Now, that's a lot of information, but we have a special tip. Water is your friend. Drink it frequently. The importance of drinking enough water cannot be overstated. There are a lot of different drinks out there, but water is always a safe bet. Feel the need for a change? If plain water gets boring, try carbonated water. A squeeze of lemon or lime, your favorite herb like mint, or anything stronger. In addition to milk, some women with PCOS may benefit from avoiding sugary drinks like soda, energy drinks, and fruit juices. Although diet sodas are better for you in terms of calorie and sugar content, they have been linked to several other health issues. Moreover, modifying your lifestyle in some ways helps reduce PCOS symptoms. Among these adjustments include increased physical activity and regular exercise. Both can aid in lowering insulin resistance when combined with a diet low in processed carbs. Doing at least 150 minutes of exercise every week is recommended by many health professionals. Losing weight may also be aided by cutting back on sweets and consuming a diet low in inflammatory foods daily. Losing weight may help women ovulate more regularly. The PCOS symptoms alone can be stressful. Techniques for reducing stress and re-establishing a link between mind and body might be useful. Yoga and meditation are two such practices. In short, PCOS may cause a lot of emotional ups and downs. You may find that your mood and the severity of your PCOS symptoms improve after adopting a diet and lifestyle that is more supportive of your condition. Keep in mind that there are certain items you might want to avoid or restrict when on a PCOS diet. On the other hand, there are often healthy alternatives to these items. If you usually have white toast with margarine for the morning, consider switching to high-fiber whole grain bread with olive oil or avocado instead. See a doctor if the condition persists. You can work with them to determine the root of the problem and get advice on how to proceed. We hope you enjoyed the video, but now that it's over, what did you think? Leave your comments down below and don't forget to hit the like button. Also, click subscribe if you enjoyed the video and want to see more from us in the future. Thank you for taking the time to watch this.